the Dr. Alex Show, and we are going to go kind of like a part two on these seizures. So that last show was pretty good, maybe okay, just kind of a little self-critique, because it's hard to talk about something that is complex like seizures and not get into the weeds of some of the nerdy stuff, but still give some info. Essentially, you have what's called epileptiform. Under that umbrella is you have seizures, and then under seizures you can have epilepsy, and then the other half is the pseudoepileptiform. So for both of these situations where we have spontaneous, too much brain activity, talking seizures, and epilepsy, or pseudoepileptiform, these next concepts are going to kind of apply across the board for what we can provide as functional neurologists. And there's probably going to be more. I'm sure there's colleagues out there that I could think of or I just don't know of that are doing great work in the world of seizures. Like I said, we don't necessarily just kind of market towards this. It's people kind of find us on their own, or they come in, they get referred in by other loved ones. So it's very rewarding, and it's a lot of fun to work on because it's more fast paced, and you really have to be on your toes. So going over some generals with this, of course we have to talk diet. We have to go to that topic. And I'll be honest, if there's one thing that I don't necessarily like to talk about and hound people on, it's diet, because it's hard. It's a habitual thing. We do it every day, so it's a hard habit to break. But when you have something going on like this, it's relatively easy to be like, yep, what are we got to do to make this change? So generally speaking, what works really well for any sort of epileptiform activity is going to be going low carbohydrate or ketogenic diet. And the reason is because glucose, even though it's the main fuel for the brain, and glucose is sugar that eventually gets broken down from food sources, even though glucose is the main fuel, the brain works relatively better, albeit after a bit of a get used to it period, off ketones. And ketones comes from breaking down fat, breaking off part of fat molecules for fuel. And the gist with glucose and seizures or any epileptiform activity is that in the end, glucose, especially here in our United States, our sugar sources are pretty inflammatory, especially towards the brain. So outside of fruits, some veggies with some sugar load, all of the processed sugars are very inflammatory for the brain, and that inflammatory process is like taking that California wildfire and just pouring gasoline on it. You're just going to add fuel to the flames. So a ketogenic diet is a pretty stout change that if you're willing to make, go for it and try it. You have to give it some time, though. I would go at least 8 weeks. Don't mess around. And with that, you can do it easier nowadays because you can get on old Amazon and you can get your keto strips. You can get strips that you urinate on when you have to go to the bathroom, and it'll tell you if you're making ketones. So you'll know if you're in that keto state. And the keto diet has been a bit of a fad type of thing. Maybe fad, maybe not, but a lot of people do discuss it for weight loss purposes and health purposes, especially in the holistic world. And the gist of it is no carbohydrates. Your body makes ketones for fuel. Your brain works really well on ketones. There's some debate and online quarrels about that, if you will, but just know that it works really well on ketones. Our body and our brain are meant to go long periods of time without carbohydrates, and we can go not as long without food. We can go very long periods, as you know, without food, and we can go even longer without carbohydrates. And the reason is whether you think we've been on this planet 6,000 years or 6 billion years, at one point, for quite some time, regardless, our ancestors had gone quite some time with only certain food sources. So if we are on the plains chasing down our antelope to eat as meat, we may not have the berries and the veggies and the rice or whatever it is to feed ourselves with carbohydrates. We might only have those animals. So our ancestors could go a really long time without any sort of carbohydrate. And then again, maybe not as long without food. What's the number they say, about 3 weeks without food? We can go quite some time. So again, we can live off ketones. It's just not comfortable because it takes a bit of a switch. It can be inflammatory initially for the brain, but then after that, the deflammatory process is pretty awesome. And when you take away that ignition source from a epileptiform activity standpoint, with seizures, epilepsy, or pseudoepileptiform activity, you can make profound changes in the individual. And with our patients, we'll advocate for it and we'll say, absolutely, it's going to be a great idea. Sometimes it is just not possible. A example is a patient in her 20s currently coming in active, wild case. I'll have to go over some tidbits here in a sec because it's actually great story time. But she started doing keto, but then she stopped doing a ketogenic diet because the medications she was on, for instance, because her seizure activity was so robust, because we are thinking she has epilepsy, so it's very chronically recurring. She's on these medications that just make food taste weird. I mean, she'll eat just about anything, and it could taste like she's biting into a piece of metal. So it happens to be that some of the foods that would actually taste good, that would actually give her something to eat, are carbohydrates. So what am I going to do there? Tell her she can't eat? It's obviously not the case. So I'm just trying to leave that up to her and her mom and her family to work that out. We're not going to sit there and say, you got to go keto or you can't be in, that's not going to work. She's not going to get better with that. She's already stressed out as is. So with the ketogenic diet, that is fantastic. Then what comes up is another concept we talked about with diet is going to be eating clean. So having artificial sweeteners, particularly aspartame, is pretty rough on the brain, and also MSG. MSG, aspartame, and some dyes and colorings are very what's called excitotoxic for the brain. Fancy term for it makes the brain fire too much until maybe even neuronal death. So if you basically clean up the food and go ketogenic to where you're not having anything artificial, then you've really reduced the ignition source and a fuel source for this underlying spontaneous activity in the brain. Now, that can be hard, again, because that's a big lifestyle change. But if it's something that you want to see to make a change in yourself, going absolutely clean away from artificial sweets, artificial flavorings, MSG is a big one, and then colors and dyes, that can take you a long way. Now, you do have to go, again, 8 weeks or more. And I think this would be a good time to bring up when it comes to dyes, colorings, MSG, anything along those lines that get put in our food to make it look good, taste good, honestly, to be more addictive. All of that, these are things that have different names. So it's not a bad idea to look up what are the AKAs, the also known as, is on food labels for MSG, for gluten, for, didn't even talk about gluten yet, for whatever it is. All of that would be a very good idea. So going on to, I guess, gluten, Going gluten-free, it's been around for as long as I can remember. Gluten, whether you're sensitive or not, can be inflammatory for the brain. So not a bad idea to knock it out. So it's like, what am I left to? You're left to what God put on this green earth. Animals, nuts, fish, seeds. If you're going ketogenic, not so much fruit, vegetables, that's it. Yeah, food's boring. It's kind of supposed to be. We've really romanticized food. We've made it very social, and we've gotten a lot of joy out of our food. And I think we're all more addicted to food than we think. Guilty as charged. I am not going to sit here and be on a pedestal. Absolutely not. So for anyone that knows me, but going gluten-free could be a really good option, but I would focus on keto and clean. Gluten-free, dairy is also not a bad idea. Dairy, casein, and whey, the two proteins, not the sugar, not the lactose, but the proteins in dairy are inflammatory for the brain as well. So if you were to take a pick, sounds counterintuitive, I'd go dairy-free. So you could keep your gluten but go dairy-free and get rid of all other carbs, which is going to be a lot of gluten-based products anyway, and then get rid of anything that's not clean. So yeah, you're really limited, and that might be a not fun reality, but you could function and feel so much better that it doesn't even matter at that point. And honestly, life gets easier because then you have less worry. There's a lot of worry and almost quote anxiety that we put into our food and our shopping and our groceries. So it's one less rock out of your backpack, honestly. That's the order of what I would go with diet. Now all of this, what I want to bring up next is plasticity. So this has been mentioned on and off on episodes that we've talked about, where plasticity is that term for brain changes. And you can have positive plasticity for positive brain changes and negative plasticity or neuroplasticity for not good brain changes. And this, having seizures, is a negative neuroplastic event. Even though it's kind of sporadic, and even epilepsy means it's random and there's no rhyme or reason. The thing is it's still creating neuronal activity that is reoccurring, and that reoccurrence is the brain laying down neuronal pathways to create that activity again. So think of plasticity like almost like deer trails going in the woods. And let's say you got deer trails that go on to the water and go on to pastures of green foods and cornfields and things that those deer want to eat. Then maybe you got the deer trails that go into areas that just don't do any good for those herds of deer. That's what seizures do. And I think that's something that needs to be understood with not only parents and patients with any sort of epileptiform activity, but also other practitioners. It's kind of silly, but in the world of medical neurology, it's not a criticism per se, but patients come back and they say things like, oh, my neurologist says that plasticity doesn't exist or it's not a thing. Like, what do you mean it's not a thing? Your brain is always changing. It's always not evolving, but it is you're either solidifying pathways and making things better for yourself and your brain, or it's going the other way around. And it's day by day in a choice by choice situation, at least at the conscious level. So these are situations that have to get unwound. So if we go with this individual that is in her 20s, she has seizures, what's going on is she's adopted, she got neglected in the foster system in Russia, got brought over, loving family, but unfortunately got into some situations where she had abuse. So now we're hitting all the boxes for a brain that's hard to work with. One is adoption. We've talked about that. Adopted brains are hard to work on and work with. We have attachment issues. Go back to those episodes. 2, we have abuse. Nasty, verbal, physical, and sexual abuse. all of them. Then we have a brain that tried to get through her days and develop, but couldn't because of attachment issues, everything that came with that, the neglect in the foster system, and then abuse. So we have a mid-20s-year-old brain that's honestly operating at maybe a 12-year-old's level, 14-year-old's level. And straw that broke the camel's back was some emotional situations that were stressful, triggered her, started having seizures. And then that just started coming and more seizures. And now we were able to get our hands on her. And for instance, what we started was, yes, ketogenic diet, started heavy into that, making sure we are clean and ketogenic. But that had to change because it really limited her eating and it was creating more distress than anything. Now, this individual, this is not like something where she's magically better after having what seems like 6 months of seizures. No. She is better as opposed to having a seizure every day. We're going once a week, but they're still nasty. And she could be going into tonic-clonics for minutes on end, and the ambulance still gets called because family and friends are concerned, and she ends up still getting hospitalized. But the few things that are helping her were the diet changes, so she's still going to be eating clean, just maybe not ketogenic. We are lasering her, of course, with our shed light cold lasers. See Dr. Griswold, shed light cold therapy lasers. And then also we work on her vagus nerve, and I'm going to talk quite a bit about that, the vagus nerve. And then we adjust her. And all of that is essentially calming down her nervous system and then giving her more capacity to handle her day. So she has psychogenic induced based seizures, meaning she's getting emotionally triggered. She's getting emotionally triggered by people in her life that shouldn't be triggers, but it's just kind of the reality. They are triggers at this point. One of them is her boyfriend. Not good. I basically said, you're going to have to not break up and just not see him anymore because it's just it's not going well. So tell him, no offense, but we'll see each other on the flip side when I get stable. I mean, seriously. He should be all right with it. Hopefully it doesn't last long. But in office, when we're working with her, the laser is increasing her capacity to handle this distress. The adjustment as well, because the adjustment is going to put her in more of a parasympathetic state overall. Also with the adjustments, individuals with seizures, y'all breathe too often and breathe too short of breaths. So what's going on is you take short breaths, and that can be because of the tonic-clonic activity in your intercostal muscles. Your muscles between your ribs are tight and spastic, and your ribs just don't move well. So I concentrate heavily on adjusting her rib cage. And then the other thing is our vagus nerve stimulator in office is awesome at waking that guy up that I'll talk about. And that's what we've started with. And we'll go into some other things as she stabilizes more. But again, we go from a seizure a day or multiple to we're having episodes of this full-on tonic-clonic once a week. So making changes without medication is very possible. This individual is on meds, but it is very possible to make big, profound changes. Now, the other thing with this whole plasticity situation, going back to that, is you have to break the mold. So again, once a day to once a week is awesome, but because they were going on for months on end, it's going to take maybe months to unwind it. However, when this is occurring, for as short as those therapeutic interventions are, it kind of goes to show how powerful it is, because if you can go from, it was, I think, 3 or 4 visits from once a day to once a week, that's how powerful some simple clinical interventions like this can be. Now, on the note of this individual has a pretty, just kind of going to say, gnarly post-ictal phase. So ictal means seizure. You're in the seizure. Post-ictal means after the seizure phase. And it is pretty brutal. For people that are around individuals with this, you have to understand you can't take offense to it. When she comes out, this individual is rude. She may not know who you are. She may want nothing to do with you. They might be scared, very angry, disgruntled, very, very tired, very fatigued. They might just go straight into nap time. That's happened with her. She's just gone into one in the office and then went into a nap. But they can say things that are just horribly offensive, and I will not repeat anything that she said, because she has said something that will offend anyone and everything on this planet. And it's just because when you're coming out of that, the brain is so stressed out. Think of the old person down the street that doesn't care anymore, and they just say what's on their mind because the frontal lobe's starting to go. That frontal lobe is so stressed they don't care. They're in full tilt protection mode, and they're going to do whatever they have to do and say whatever they have to say to stay in that protection mode. So don't take offense to any of what comes out of their mouths. Some people come in and their loved ones are just sick of it, and I'm like, well, it's not them. You have to give them a sec. And most of the time they don't even remember it. So little grace there. Just a side note. Now, the other thing that works well is from an at-home perspective. We have this individual do breathing exercises. So simple breathing exercises like 1-to-2 ratio breathing. The amount of time you breathe in, you double it breathing out. Breathing in is a sympathetic nervous system activity. Breathing out is a parasympathetic nervous system activity, and a parasympathetic is the resting, digesting, cool, calm, collected part of the nervous system. And the more we activate that in this case, the better. And this 1-to-2 ratio breathing activates the vagus nerve. So going into the vagus nerve, sometimes people with epilepsy have vagal nerve stimulators or vagus nerve stimulators. Sometimes they don't. Nowadays, you can buy over-the-counter ones online. There's no connection to this, but I love this brand called Hoolest, Hoolest. Recommend it to our patients all the time for various issues. If you guys are looking for your own little vagus nerve stimulator. But we have some pretty powerful units in the office that work really well to wake up that vagus nerve. You can do some things at home like the breathing and a vagus nerve stimulator and other ways that you can look up online for vagal nerve activation. And that's important because when the vagus nerve is properly activated, it puts us in the parasympathetic state because it's the hub of your parasympathetic nervous system, and it's anti-inflammatory when it is activated. It is going to deflame. It's going to send out messages to wake up parts of the immune system, to send out anti-inflammatory cytokines, cells to start cleaning things up. So it is very, very crucial to have that activated, which is why you might see people with vagus nerve stimulators implanted, or even doing operations where they will have they'll get part of their sympathetic nervous system clipped, essentially, or blocked to stop the activation of the sympathetic side and let the parasympathetic activate. I can't do any of that, nor do I want to, so we try to focus on both from a holistic standpoint. Again, decreasing inflammation, increasing the parasympathetic. From a supplement standpoint, magnesium can go a long way. Good magnesium, a magnesium threonate is awesome for crossing the blood-brain barrier. DHA. So there is there's two fatty acids, in fish oil, EPA, DHA. EPA is awesome at keeping your cardiovascular system clean. It's why people will supplement fish oil for cardiovascular health. Then DHA has more of a profound effect on neuronal function. So we have high ratio, high potency DHA, 20 to 1 ratio. So in about 1,200 milligrams of DHA, there's like maybe 50 or 25 milligrams, something like that, of the EPA. And huge doses of that DHA feed that brain that fatty acid and help it deflame and just calm down. Just imagine it kind of melting a little bit. That is pretty fantastic at overall decreasing inflammation from just a simple mild brain inflammatory standpoint to doing this as well. If the patient is relatively stable and they do not have any genetic single nucleotide polymorphisms or any issues with what's called methylation, it'd be a good idea to consider maybe things like turmeric and glutathione to help them further deflame and feed antioxidants to the brain. However, I usually start with those two, DHA, maybe some magnesium, and cleaning up the diet. And then what that does with in-office work is it helps establish a new baseline. And then when things settle out, then I go into functional medicine-based testing, where we might pull stool samples to see what's out of whack with our GI tract that we can bring back in whack with good bacteria, reducing chronic low-grade infections, anything along those lines. Doing an organic acids test to see what is, again, out of whack with acids that are found in our urine that can tell us about pathways with neurotransmitters, methylation, nutrient deficiencies, pathways with our mitochondria even. And bringing any of that back into proper function can go a long way. Looking at methylation at that point is really good. Methylation means you activate things in the body. So real quick, you take a protein and then you have to methylate it. That means you put a carboxyl group on it. So go back to organic chemistry days. Kind of painful, but you take one carbon and 3 hydrogens, attach it to a protein, do some other things to it, and it makes it active. So you take a protein and you turn it into a neurotransmitter, or you take a protein and then it allows your DNA to methylate and express what it needs to do. You can have soft genetic single nucleotide polymorphisms along the way of making this methylation occur. And you can support it with specific supplements and diet changes. That can go a long way to calm the brain down, because sometimes people with any sort of form of epilepsy, there's going to be some genetic component, whether they have a hard genetic mutation with these electrolyte channels like sodium and potassium, or some other hereditary component that can contribute. So those tests right there can go a real long way, and really getting down to the root cause of even some of their, I guess, more dietary-based triggers. For seizures nowadays, for people that are coming in, we are seeing them triggered with just distress in general. People's resiliency, again, I'm going to blame it on COVID, kind of broke COVID. People's resiliency went down with COVID. So anxieties, distresses are up or just not handled as well, or whatever that is. And regardless, people are coming in with distress triggering seizures, whether they have functional neurological disorder or something else. So helping find what those triggers are, and if they can get removed, great. If we can learn how to manage them, please. Because, for instance, if work is a trigger, if you're an 18-year-old and you're living at home and work is a trigger, ask mom and dad to be at home more. That's a good example. Just stop work. It's fine. Take care of yourself for a little bit. But if you're a 35-year-old and you have to work and you can't figure out another job, okay, that's a little bit different of a story. So we have to learn to manage that. We can't just sit there and be like, go ahead and quit work. That's not going to happen unless you want to go on disability or something. So managing triggers is going to be the big one. And then I would say, lastly, overall, when it comes to all of this, is when you're diving into this functional medicine world, functional neurology world, you're going to find yourself doing a mix of these diet changes and then things to activate the vagus nerve or activate your frontal lobes or calm your brain down. Whatever you find that works, the biggest thing is you have to stick to it. Again, at least 8 weeks to see some good changes, because we're talking about plasticity. We're talking about the brain changing, and you could have your situation for months or years or decades, and it may not take that long to see a change, but it might take weeks. So you have to give it a fair shot of at least weeks to see if it makes a change. And all of this can be applied to quite a few situations across the board, whether it's full-blown, nasty, pathological situations that I know nothing about when it comes to seizures, or if it is your, for lack of a better term, typical epilepsy or pseudo-epileptiform activity, which is that unhealthy brain or unhealthy area of the brain that walks, talks, and smells like seizures. All of that can get applied. It can all work. It can all do something for you. Do not be discouraged if you're trying something and it doesn't work. Give it time, and it might just take further tweaking, because even sometimes what we do to play detective is we do like one thing at a time. Like, well, I did the ketogenic diet and it didn't work. Okay, that's awesome. And you'll find me saying in office a lot, like, it's maybe a good idea when we make one change, like we're going to do like one supplement and see what happens, or one lifestyle change and see what happens. But in this situation, your positive neuroplasticity changes might need everything at once. It might need all of that to make the change. And that's going to drive some of you crazy at that thought process. But for something that is as neurologically robust as seizures can be, whether, again, it's your hand tingling to a full-blown tonic-clonic, it is brain activity that has just gone haywire, just out of control. And it is firing like crazy. And if it is doing it repeatedly, it is gaining a lot of strength. And it didn't just do that from one lifestyle change, one diet change. It happened over the course of time. It built up. It's like the cliche bodybuilder bends over to pick up a pencil and, quote, throws his back out. It obviously wasn't the pencil. It's because he had underlying movement dysfunction, what we call subluxations, where his spine wasn't moving well, and we had muscle spasms and maybe scar tissue and other dysfunction in his low back. And eventually it was just that simple act of bending over that was his straw that broke his camel's back, if you will. So when seizures kick in, it's going to be a mix of issues, because even if you have a genetic susceptibility, let's say you're a twin and then you have seizures, but your twin doesn't have seizures, but you have this genetic testing that shows that y'all have the genetic susceptibility to have seizures, but Johnny has seizures, Jimmy does not. Why does Jimmy not? Well, maybe he's doing different things for his health that Johnny is not. So it might honestly take all of that to make a change. So don't be discouraged if you're trying one thing at a time, because you want to be methodical. If it's not working, start piling it on, because it might take that to break the mold. So just a couple things I've learned over the years. So I think that might do it. These shows were a little shorter, but I kind of wanted to break them up about what are seizures. If there's any requests on going down the rabbit hole of more in-depth information about it, let me know. I figured people wouldn't be too interested in that per se, but going into what can be done about them is the main meat and potatoes. So hope you guys enjoyed that, and we'll catch you next time.
All right, everyone. The Dr. Alex Show is brought to you by Shed Light Cold Lasers. Shed Light Cold Lasers is, bar none, the biggest thing that has changed our practice at HML. Not only on a professional basis and the results that we are getting with our patients, because for all the professionals out there, everything from veterinarians to medical doctors to everyone in between, you can use this laser in your practice for just about anything. But on a personal basis, because what's unique about this laser is it is handheld. And if you know anything about cold lasers, a lot of times they're big, they're gaudy, you almost have to bolt them to a wall and you can't take them anywhere. This one you can take anywhere. That's because the diodes are LED, so it runs on really good lithium-ion batteries. And the other awesome feature about this, if you know anything about lasers, is that you can kind of see it on camera there. This laser has red light and infrared light. So we won't go into the details there, but just know that you got all of those features. It also comes preloaded with all of the presets to work on specific organ systems, to work on different areas of the brain, like our specialty at HML, as well as a whole host of other things that you can do with this laser. And to learn more about the lasers, head on over to shedlightcoldlasers.com, 518-338-6658, or you can email Dr. Griswold, or Griswold as I call him, shedlightinformation@gmail.com. And we want to note that you don't have to be a doc to buy these. You can be a patient, someone off the street. And Shed Light specializes in educating professionals, doctors, therapists, as well as lay public people, if you will. If they want to buy a laser, they will completely educate you on how to use it, or they will send you to a doc on the ground, someone like us, to learn how to use it, or they'll just send you to that doctor's office, and then you can let the doc take over. Either way, they'll give you all the knowledge and information and resources you need to either get that laser or where to find one in the doc's office.